Just hit it. Therapeutic Thursday, everybody. All right. As we told you, every year we try to come up with a theme. We've been doing this for a while. Let's see if we can recant our themes. So 2020 was movement for movement. 21 was emotional health. 22 was collaboration. 23 was helping us help you be all you can be in 23. And 24 is receive more in 24. So here is some of the ways that you can receive more from Aortic Hope or just yourselves in 2024. So if you're in the position to schedule elective surgery and find yourself asking a lot of questions like, what should I bring to the hospital? What will recovery actually look like or be like? Just any of those types of questions, especially when you have an opportunity to have an elective event, then you need to take a look at our pre and post surgical suggestions. We have a list. Here's the link to the list. Let's get into this list. The fun thing about this list is it was completely created by members of the community sharing things from their own personal experiences. So there's really nothing that's massively scientific to this. This is just what's worked for other people and tips and tricks of when you have an opportunity to schedule something. Here's what you might want to think about. So it's strongly suggested that you have a loved one with you. Now we're in this post-COVID and yet COVID numbers ticking up world. You really do want to talk to the hospital before you have your scheduled surgery. Find out who can come with you. Can they spend the night? Because things are beginning to change a little bit depending where you live and how your numbers are with COVID, RSV, and flu in your hospitals. Okay. But assuming that everything is fine, you want to have somebody with you before your surgery, during, and after, because you need an extra set of ears. We're so nervous. We have so many things going on in our mind that a lot of us tend to miss stuff, right? It's going to go right over our head. So even if it's not a family member, bring a friend. Bring a friend, have them ask questions. Always somebody else is going to have another question to ask. It's just a scary, it's an emotional time. They're going to help you retain the answers anyway, and maybe can take notes for you. Another person that cares about you being present, really, they, as I said, they're going to have other questions. They can help you have your questions be addressed there. And they're also a nice emotional support person. Make a list of questions ahead of time that you might have. Here's some things that you might want to ask. So, how many hours do you think the surgery is going to last? This is important, not for you, because you're going to be asleep. It's important for your loved ones, for your friends and family that are waiting. They want to have a general sense, because if you tell somebody it's 5 hours and the doctor walks out at 4.5, people get really scared. They think they're about to receive bad news, and it's just going to be jarring until they see a smile on the doctor's face. If you tell somebody this surgery is going to take 5 hours and we're in hour 7, they're going to be very frantic, wondering what complication has happened. So let's get a realistic expectation of time frame. I think a surgeon is always going to overshoot rather than under promise. And it'll always be great to see somebody earlier than anticipated, right? They'll have an idea and if they should leave to get a cup of coffee, whatever the case is, but ask that question. How long do you think it's going to take? How long do you think you're going to have to be in the hospital? Like, what's the recovery looking like? Am I in the hospital? Am I going to rehab? Am I just going to a step down unit? How long am I going to be in this facility or a facility? That's important to know. What exactly is the procedure? Are you repairing an aneurysm and doing a valve? Are you going in to repair an aneurysm and it could be valve sparing? But what if you need to repair the valve? Let's talk about valve options ahead of time, because once you're under, they're going to go to your next of kin to ask, I need to now fix their valve. What kind of valve do they want? So you need to have all of these things thought of, decisions made ahead of time. In the event there's some completely different um, procedure that needs to take place. And obviously talk about the risks, the pros, the cons, the whole 9 yards. Okay, when should you wake up? What does waking up look like? Am I going to have a breathing tube in? Am I going to know? Everybody wants to know, am I going to know if I'm on a ventilator? And, everybody's experience is different. I don't think I realized I was on a vent, but I thought that I was Aquaman and I thought I can breathe or not breathe. But if I don't breathe, then I breathe. Yeah, I didn't know. I didn't understand. I was just being woken up enough. And then I was told to cough, and then it just came out. It's not one of those things that I can even tell you if it hurt coming out. My throat hurt afterwards. While the vent was in, evidently, I asked for a piece of paper and I was writing questions like, am I alive? Am I breathing? Am I okay? I have absolutely not even one thought about that. I don't recall any of it. And they didn't save the paper for me, but I was told by my father that I was writing, scribbling questions. So, will you be aware? Maybe. Will you really remember it as being horrible? Probably not, but there's no guarantees. I think the goal is to have everybody not really remember until they start waking you up so that you can breathe and they can see that you're trying to breathe more on your own. And at the end of the day, there's nothing you can do about it. It's not going to scar you, I don't think, for the rest of your life. I would hope not. It's part of the process. If it is, it might not be. You have to ask. Catheter. Will there be a catheter in place? How long will a urinary catheter stay in place? That's important to know too. What are we talking IVs? If you care, we people who had an emergency dissection, we didn't get a chance to ask. We just woke up, lit up like a Christmas tree. So if I have to, and I will have to have additional surgery, I want to know: am I going to have a line in my neck? I didn't like that line in my neck. Not that I'm asking because I have a choice. I like to be prepared. I want to know, is my arms going to be taped to boards and then strapped down to the bed when I wake up? Because that's how I woke up with my emergency. I'm just somebody who likes to know. So if you like to know, that's a good thing to know. I am a big person on wanting to know about a pain management plan. I do not do well with pain. And it's not that I'm a baby, and it's not that I have a low tolerance. I've had experiences where I've been in a lot of pain, and when you push the button, nobody's coming because it's nurse change time. It's shift change. And when your pain meds fully wear off, you are now chasing pain. And that can be um, just horribly painful and not necessary. So if I'm told, well, this is the pain management, this is what we're going to give you before you wake up, maybe you have a patient controlled apparatus you can push, what have you. I like to just know what the plan is when it comes to pain management. All right, number 3, if you're someone who tends to become anxious, discuss this with your physician because there is a chance they can give you a little something, something beforehand, kind of make you feel a little bit more comfortable, take the edge off. It might make the whole thing a lot more easier to tolerate. We've already discussed this. See if they'll allow a family member with you in the hospital. I know now for most part, with something scheduled, they'll let them come back once you've been have all your lines in you and you're situated while you're waiting, which is just nerve wracking. They'll let somebody stay with you till they will you back. That is pretty standard now. It's the same with you afterwards, that each hospital system is changing their rules a little bit. All right. 5, suggestions on what to pack. If it were up to me, I would tell you pack nothing but a charger. Just anything you bring with you, you have to now schlep home. It's a lot. And if you end up in the ICU, less is best. Less is best. But some people have suggested if you have an idea how long you're going to be there, you may want to have your own pajamas. These pajamas where our butts hang out the back are not necessarily the greatest. They're not necessarily IV friendly. You have to untie them and then they're hanging off of you. They fall off. Um, I'm a less is best, but if you want to bring your own pajamas, of course you certainly can. I'm also would be nervous that maybe I started bleeding from one of my lines, so I don't want to mess anything up. But they're soft. They remind you of home. If you think it'll make you feel better, then you should do it. If you do not want to wear their treaded socks, although sometimes these different colored treaded socks mean something different, like a potential fall risk. Uh, Bring your own. But if you're going to bring your own socks, make sure they have the little rubber treads because the last thing you need when you start walking around is to slip. That is not what you want.
Oh,
Slippers, if you're going, what?
let me break in there. So during the Aorta hangout, we had a new lady
Yeah.
jump in and tell us about having her post dissection troubles. I think she's about a month and a half out,
Yeah.
and she was getting so cabin fever so badly, and there's snow everywhere that she's out
Um,
walking on snowshoes. I'm like,
on
and
snowshoes.
I'm like, do not fall.
Do not fall. And like, that's a whole other conversation on what that super cold weather could be doing to her blood pressure and her vessels. But okay, snowshoes. Well, getting back to slippers, don't get slippers that you slip your feet into that, like kind of flip and flop behind your heels. Put on an actual shoe like a moccasin because you don't want to, take that step forward and your slipper kind of slips off and now you just don't want to trip. Sometimes using what they give you and not your own is better. It's you're protected underneath of them because it's their devices. You want to just wear them in your room when you're sitting on a chair because it reminds you of home, great. But my suggestion would be less is best. Just use their socks. Women, we get this question a lot, because sometimes when you have your aneurysm fixed, you're going to need open heart surgery. It is not every time, but it is sometimes. Same thing with valve replacement. Bras. A lot of times, don't worry about it. But ask this question ahead of time. Some hospitals, when you wake up, you're in a bra that they give you that clasps in the front. And yes, it doesn't matter what size you are, they have bras that fit all people with clasps in the front, which is pretty amazing. If you're a woman, you know what I'm talking about. But sometimes they provide them to you. And if they do, you might want to ask to take home an extra one in whatever size they put you in because it's going to be your best friend. You cannot reach behind yourself to clasp or unclasp. I'm a spinning around to the front, so as many other women, not to give you too much information, but even that's challenging after you've had open heart surgery. So to be able to clasp right in the front is so much better. So if you're comfortable in what they put you in, ask to take home another one. It's worth spending the money and it's less than what you're going to spend in the store and you already have it, so it's convenient.
That's like the first time I've ever heard buying anything in a hospital is less than buying it from the store.
Well, it's also the convenience. It's there. It's like, trust me when I say you're in no frame of mind to think, oh, I love this. Let me focus on my phone and order one from Amazon Prime so it's here tomorrow. You can't even see the screen. You're so, it's like, it's not going to happen. There is no playing on phones. You can barely keep your eyes open long enough to say hi, thanks for visiting, and then you fall back to sleep. So, unless you have a family member, which would be great, ask the nurse, what is she wearing? Write it down, go to Amazon, try to find it, hope it's the exact medical grade, same thing, and then order it. And then it arrives. It's so much more convenient because by the time you're ready to discharge, it's already in your bag. Really, trust me. Trust
Diane
me.
says, let them girls be
It's true.
free.
Some people try that too, girlfriend, and it's painful. It really can be painful if it's free. It could tug on your incision. So that's something to think about too. But everybody's different. So it might be easier for you if you let them fly free, or it might be easier if you hoist them. Depends on if you're a hoisting kind of person. What am I saying? Okay, next. Some people suggest bringing essential oils. Essential oils work. They're scientifically proven to work. So, lavender, chamomile, rose, frankincense, these are all oils that will reduce stress and anxiety. They produce a calming effect. That's why spas use these smells a lot. So, eucalyptus, menthol, peppermint, they're all the kind of things that wake you up. So if you want something that's going to be calming, chamomile, lavender, rose, frankincense, consider bringing some of those oils. And they're great if you're in a room by yourself. Please do not think about using them if you're sharing a room with somebody because they may be very allergic. And if there's an essential oil, let's say that is melon based, there are people that are allergic to melon so bad that if it ends up a vapor in the air, they could go into anaphylactic shock. So there's a lot to think about here. If you're in a room by yourself, go for it. And we're going to get into one of those essential oils in a minute. Okay. Some hospitals are actually giving lavender. They're giving you these kits that have an eye mask, earplugs, a little bit of essential oil because they want you to try to sleep because we know we can't sleep in hospitals. It's just noisy and beepy and lights and whatever. All right. Should you bring toiletries? Some people say you should. If you like your Sensodyne toothpaste, you should bring it. You should bring your own toothbrush. You could bring an electric razor. You can bring shampoo, conditioner. I didn't even know my room had a shower. I never made it to my bathroom in my room. Some people don't. So, in other surgeries I've had, I ended up getting to a place where I took a shower. Do you think I really cared about my own shampoo, conditioner, and body wash? Getting that sponge bath was the best thing in the world. I didn't have to do anything. I didn't have to take care of any of that. So again, it depends on how you are with surgery. If after a day or two and you're feeling up to it and you want your family member or loved one to bring them because it makes you feel better, it's all about what's going to make you feel better. I couldn't have cared less about what kind of toothpaste I was using. And quite frankly, I used the toothbrush she gave me. Why? It was something less that I didn't have to take home with me. Less is best. Okay. Same thing with deodorant. Now, I will say with deodorant, hospitals tend to give roll on deodorant and they are very wet and you're stuck flapping around for a while just trying to dry your armpits. So, that I would probably bring my own thing because I like a stick and I
I'm
don't like
allergic to
using
those.
what?
I'm allergic to those.
You're allergic to roll on or stick?
The like the roll-on bar stuff.
Okay, that's two totally different things.
Yeah, I can only use whatever like the cream stuff is for deodorant.
Yeah, I like a thick, just the stick, the solid. I like a
No, no, I'm
solid. I
allergic
don't
to
like
that.
liquid.
Yeah.
You're allergic to solid. Okay.
And,
So,
and
yeah.
the
So
liquid is what I'm saying. Both of those.
you like a spray.
No, 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 no. I don't mind a spray, but it's like there's
Okay.
a cream one that men can have.
Interesting. That sounds like a
Yeah,
Lumi. Well, you know what? In your case, you would want to bring something with you.
I wouldn't use any of them. I'm gonna stink.
Okay. All right. But familiar tastes, familiar smells, familiar sensations might bring you joy and might make you happy. Uh, so when it comes to toiletries, consider what you want to bring that might make you happy, but you still have to pack it up and take it home or just throw it away. That's on you, right? Definitely pack your cell phone and your charger because you may want to text people and tell everybody you're okay, or you may just be like, the hell with it, I don't care. You may want to have it in case you want to call a loved one, but then usually hospitals have it's called a landline. Not many people remember those, but you can use their landline, their phones in the hospital room, and they don't charge you anymore to connect them. I can't believe there was a day where they used to charge you to use their cell phone, their telephone. Um, I wouldn't even worry about an iPad because you're not going to have enough energy to actually play Candy Crush or something like that or to read. Just allow yourself this time to just disconnect and just be in recovery. And of course, remember anything you take to the hospital, you have to take home, except a visitor. Visitors are great if it's somebody that you like, if it's like one of the top 10 humans you actually enjoy, but they can make you feel better. They can make you feel like they're lightening things up, lightening up the mood a little bit. Just make sure they check in with you or your loved one, the person you've designated, because it might not be a good time. Maybe you aren't sleeping, maybe you are napping, but visitors could be really good for the soul. And don't, as we talked about pain earlier, don't try to don't try to tough out pain. You don't want to be chasing pain. So if you're in too much pain, that can create a trickle down effect. You might end up having higher blood pressure. You could end up having higher heart rate. So really stay ahead of pain. Feel comfortable pushing a PCA if you're given one. That is a patient controlled analgesia. It's a button. You hold it, you push it, it's going to give you pain medication. You could push it 10 times in a row. It's not going to give you 10 different dosages. It knows when you're allowed to actually have that medication administered. So, but you push it if it's time. If you don't remember, just push it and see if you get anything. And if you are uncomfortable, push the call button and let your nurse know. Maybe you need breakthrough pain medication control too. So don't be afraid unless you have like a predisposed issue to an addiction. A narcotic is not a terrible thing to take in the beginning. What can happen if you're on it long term is you can become constipated and you will need to have a stool softener because you don't want to have to bear down when going to the bathroom. So that is something a doctor is going to talk to you about as well. My general thought is, though, as well as the community member who contributed this, is you don't want to chase pain. Okay. And if you're in the ICU or the SICU, it's usually 2-to-1 ratio, 2 patients, 1 nurse. So you should be able to reach out and someone will respond to you. Okay. Get up, sit, and walk when cleared and told to do so. Do it as often as they tell you you can. So as soon as they say, if you would like to walk, let us know. We'll come in and we'll walk with you. Try to do it as much as you can. Even if you feel tired, and all you can do that minute is just get up and walk to the chair in your room. The more you move, the more you turn on your systems, the more you get your intestines stimulated, the sooner they can give you food, the more you're keeping that blood flowing, the more you're using your heart, the more you're into recovery mode, the closer you are to going home. So and your doctor says walk and move and sit, then you need to do what your doctor is saying. And if you can't, you need to speak up and let somebody know why. Okay, somebody had said take a picture of you when you're in the hospital. Excuse me. Examples of pictures could be when you're on a respirator, could be right before you are wheeled out. Some people, some loved ones want to do that because they're fearful they may not see them again. It could be taking a picture of you when you're sitting in a chair. It could be when you're taking your first few steps. Some of the beneficial reasons to take pictures during that beginning stage is because that gives you it's almost a documented visual diary, so that as you continue down your road of recovery, when you sit there, as many do, and they get to this point when they're like, I am not getting better, this is taking so long. When you look back and you see how bad things looked when you were just sitting in a chair, you will realize, oh, wait a minute. No, I'm actually doing much better than I was a week ago. And to that point, don't look at recovery in terms of um, days or minutes or hours. You have to look at it, give yourself, I know people say it's a process, so day at a time. Yes, one day at a time, but don't actually go to look at how am I progressing until it's been at least a week or two. That's when you're going to see remarkable difference. But pictures do help. They do help, and you can always toss them if you want. It's not anything that has to be publicly displayed. People do find it therapeutic to look back and to see. I know I have pictures. I didn't tell my husband to take pictures, but he took one in the initial hospital when I was first diagnosed with this dissection. He took one when I had just had the breathing tube taken out. And he took one the first time my angel of a nurse washed my hair and put it in a bun. And when I just had the nasal cannula, the oxygen tube in. And the difference is amazing. It's amazing. And it was a hard picture. It's not a pleasant looking picture, the one where I'm lit up like a Christmas tree. But I look so different. And I noticed it right after the end of the first week when I finally got home. And I remember looking at myself and thinking I looked like a monster. And then I went back and looked at that and I was like, oh my God, I'm alive and I have color. Look at what I look like there. You know, I was bloated. I had all these IV lines in me. I had just been through the ringer, and it really helped me with my perspective on where I was in recovery. Okay, moving on. Ask a close friend or a family member to provide updates for you. If you're on Facebook, Instagram, wherever it may be, uh, people are going to be concerned. Even in a scheduled elective surgery, they're going to be concerned. This is very tough for them as well. You cannot discount that you are going through some fear and a lot of emotions in a watchful waiting scenario, but so are they. So are they. And one of the easiest ways to do it is to create a caringbridge.org account. So in CaringBridge, you can put photos, you can put updates, you can put links to your favorite charity like Aortic Hope, right? And people can make donations, people can leave comments, people can leave well wishes and cheer you on through CaringBridge to not clog up Facebook. The other bonus is if it's not in Facebook, it's not going to come up on your history and your memories. If you wanted to, then put it in Facebook. But for some people, it's too hard emotionally. So CaringBridge is the way to go. Okay. And then you direct people that you really feel close to, that you feel you want to share this information with, direct them to go there. When your friends and your family members come to visit, tell them to bring cards, because you might be in and out of sleep, and this way they can keep themselves busy and not just watch TV. They can, you know what I mean? They can play a little game, checkers, whatever the case may be. Because surgery can take a lot of hours. I know they're going to be on edge, but especially when you're in recovery and you're in your room, this might help them pass the time away. Ask questions about your surgery when you're nearing the time when you might be discharged. You're going to have to ask them over and over and over again sometimes because you might not have great short-term memory initially due to the surgery and due to medications. You might not even remember why you're in the hospital to begin with. That is okay. It's all normal. So, to any of your loved ones, let them know this will be normal. Many people report not even remembering what got them to be there in the first place, or remember what the doctor said, or remember who visited. No, it does not mean you had a stroke. It means that you are recovering from something that was huge, that was big. Um, and it's okay to cry. A lot of people have a lot of emotions, especially after open heart surgery, more so men than women. I don't know that there's been a scientific study about this, but if you find your loved one is crying at a kitten food commercial because there's kittens, that's normal. Okay. Crying because you feel like you could have died is normal. Just crying because you're tired, you're crying because you're not sleeping well in the bed, you're crying because you're taking all these medications, and everything is different. It's normal. It will subside. It could take a few weeks, but it will subside. And if you find that it's creating issues with sleeping, or your eating disturbance, or nightmares, or what have you, please mention it to your physician, because now you might be in a situation where you might benefit from a social worker or a therapist to come and talk to you. All right, remember we talked about uh, aromatherapy. So, tried and true, peppermint. Bring peppermint with you. And I say this because when you've had a catheter, sometimes smelling peppermint will actually help you go to the bathroom. So, after that catheter comes out and your bladder has been basically paralyzed during surgery, when you have uh, a smell of peppermint, it relaxes the muscles. And I know this personally because when I had a C-section and they took the catheter out, I couldn't go. And I was actually begging to be recathed. And then she dropped a couple oils of peppermint oil, and like a couple drops of peppermint oil, and I went right away. So every time I have scheduled surgery, I bring an Altoid, or I bring Crest toothpaste because it's really nice and minty, and I smell it, and then I go right to the bathroom. I'm telling you, it works. It may not work for everybody, but it works for the majority of people. Okay, here's some more great tips. Potassium. Sometimes our levels of potassium or magnesium, they get wonky and they go off the rails when we have surgery. If you need potassium, it burns in the IV. I don't know how else to tell you. It burns. And hopefully you have a really good empathetic skilled nurse, and they recognize you're going to be there for a few days, and so they will mix it up well and have saline going at the same time, and they'll slow down the speed and the ratio will be different. But when it starts to burn, if it starts to burn, hit the button right away. You can take potassium via pill or liquid. It's disgusting in liquid. Pill could make your tummy feel jacked up. But there's ways to take it in the IV that will minimize the impact to your veins. Just have a conversation with your nurse. If it happens to you, I'm not ever saying any of this is guaranteed to happen. These tips are based on other people's experiences, okay? Nurses are incredible, incredible. But it doesn't mean you're going to mesh with all of them. And there is nothing wrong that if you just feel there's a personality conflict, ask for the charge nurse and ask if you can just not have that nurse again. Just ask, can I just have somebody else assigned to my room moving forward for however long I'm here? Or right now in the immediate, I need somebody else. We're just, there's a miss. There's a miss. We're not aligned. I'd feel better. It's perfectly okay. It's within your right, and they will make that accommodation for you. You do not need the extra stress. You are recovering. Okay. Find out from your physician if he or she is going to try to prescribe cardiac rehab. If you're having your valve replaced, typically it's not an issue because the valve's part of the heart. Cardiac rehab happens when things happen to your heart. A lot of times people who have aneurysms or dissections, they're not granted cardiac rehab for some reason from their insurance. But if you are not granted cardiac rehab and your physician wanted you to have cardiac rehab, ask about getting a script for physical therapy. If you get a good DPT, doctor of physical therapy, they will learn about the ranges for your heart rate, your blood pressure goals from your physician. They will report those findings on when you eventually start to move your body around. They're also going to report what you feel your exertion rate was, how tired you were, sensations you were feeling. So it's different because you don't have a EKG monitor on you while you're moving your body, but the reporting structure would still be the same. And this way you'll learn diaphragmatic breathing, ways to feel more confident about sitting upright and about stretching. They'll take you through all of that. So don't, if they say no to rehab, still make it a yes. There's other things that you can do. Sometimes you can come out of surgery and survivors have reported having pain in their shoulders. This is normal. It's due to positioning. It should get better with stretching when you are allowed to stretch, depending on if you had open heart surgery or not. There's a lot of variables here. Again, this is all just suggestions based off of other people's experiences. Let's talk about mental health. As described earlier, some survivors have discussed feeling depressed, blue, whatever after surgery. This is, again, very normal. When people are having nightmares or they're having triggers that make them hear things that aren't happening, smell, taste, feel things that aren't happening, that now is typically symptoms of potential post-traumatic stress. Your brain gets affected when it has major trauma or major surgery, and it needs to be cared for because the brain basically takes a back seat as your body is being worked on. So don't hesitate reaching out to a licensed clinical social worker or just a social worker for some kind of support or individual therapy. There are many different individuals out there. Only LCSWCs, I believe, are specialized in providing direct, specific treatment options for people with post-traumatic stress, including but not limited to EMDR or eye movement desensitization and reprocessing. There's also support groups. We don't know of many that exist anymore that are brick and mortar where you go face to face, but Aortic Hope is the only organization really that is offering virtual support groups. It's a very strong community led by other patients, other caregivers, gives you an opportunity to really ask questions, hear about other people's experiences, and on occasion, we do have guest speakers, thoracic surgeon, cardiologist, other mental health clinicians will come out, will answer questions, give you some of their time, and then they'll leave so you can have that private environment to kind of share what you're feeling and you're thinking. Now, if you want an environment that's not very serious, but this is still after you've had all of these, this procedure done, then consider joining Aortic Hope's Hangout. You need to sign up the same way. Gives you an opportunity to have a much more lighthearted experience with people who have had similar things to you, but maybe we're not talking about the heavy topics and conversations. So that is the very extensive pre and post suggestions list. We would love to hear from you if you have things that we did not think about adding on this. You can always email us at info@aortichope.org and just say pre-post suggestions list, and we'll be sure to add your idea to this list.